From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus, North Carolina News Brief for Tuesday, June 9th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Yesterday, a North Carolina Superior Court judge ruled that a coalition of civil rights groups are likely to win their claim that the incarceration of state prisoners during the COVID-19 pandemic is unconstitutional. The group is composed of 5 civil rights organizations, including the ACLU of North Carolina, Disability Rights North Carolina, and the National Juvenile Justice Network, who filed the lawsuit in April against Governor Roy Cooper and the North Carolina Department of Public Safety Secretary Eric Hooks, claiming the state is failing to protect prisoners from COVID-19 outbreaks. Testing and procedures at state prisons have been a point of conflict since the start of the pandemic in March. A month later, mass testing within Noose Correctional Institution in Goldsboro uncovered well over 400 cases. All of the offenders who tested positive have since been deemed recovered based on federal and state health guidance. Last month, the state went forward with a program to test detention center staff for the virus after logistical concerns had previously halted the process. Yesterday, the judge ruled the plaintiffs were likely to win their claim and ordered all parties to reconvene later this month to make a plan to keep prisoners safe. Since mid-April, when the suit was filed, the state has released approximately 750 people, or 2% of the 34,000 people who were in state custody. So far, 5 state prisoners have died from COVID-19. Yesterday, State Health Secretary Dr. Mandy Cohen said that a new analysis of health studies shows as many as 49% of cases of the novel coronavirus are spread by people who are not showing symptoms. Some of those people may infect others and may go on to show symptoms a few days later. Others may never show symptoms at all. Anyone who has the infection and is not wearing a mask can easily spread it to people around them, Cohen said. That's what makes her 3 W's, wear a face covering, wait 6 feet apart, and wash hands regularly with soap and water, so important. Cohen said state leaders are especially worried about mass gatherings, like speedway races or large conventions. One so-called super spreader at one of those events could spark an outbreak of the virus, and people in attendance from other places could take it home with them. The fact that coronavirus can be spread by those who are symptom-free raises a question about safety screenings. As many businesses open back up, they're relying on temperature checks for employees and customers. But if someone is infected and not showing symptoms, they wouldn't have a fever, so the screening wouldn't catch them. Today, Governor Roy Cooper will be tested for COVID-19 after he spoke with protesters gathering in Raleigh. Cooper's administration is asking anyone who has been in a large group to seek testing as soon as possible, whether they present symptoms or not. If someone tests positive for the virus, they're asked to quarantine for a minimum of 2 weeks to limit potential spread. And finally, hospital patients could designate at least one visitor despite the coronavirus pandemic under legislation under consideration this week in the state Senate. Today, senators heard painful stories from people whose loved ones suffered alone because of visitor restrictions hospitals put in place to lower the transmission of COVID-19. In some cases, people said their loved ones got worse care because no one was there to ask questions or advocate for them. Senate Bill 730, the No Patient Left Alone Act, would guarantee patients the ability to designate one visitor with the unrestricted privilege of being present while the patient is in a hospital's care. Bill supporters said they understand hospitals want to limit foot traffic due to COVID-19 and that they're working with the State Hospital Association's lobbyists on details. The Senate Healthcare Committee plans to hear a presentation from the association on Thursday morning, then vote on the bill. From there, the bill may go through other committees before going to the Senate and eventually the House for final votes. Today's committee hearing on the bill was discussion only. This has been your Coronavirus North Carolina News Brief for Tuesday, June 9th, 2020. As always, if you like the news and information you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.